Hi, Paul Sakis, Good News Broadcast. We're speaking to Sarah Wise Miller. Hi, Sarah. How are you?
I'm great. How are you?
Okay, good. And we're also speaking to Sanjiv Afarwala. Hi, it's doctor, right?
Yes, correct, yes.
And you're the chief of oncology and hematology at the St. Luke's Cancer in Bethlehem, Pennsylvania. Is that right?
Correct. That's correct, yes.
Okay, I got it all out. And then we have Sarah Wise Miller, and she is on the chairman of the board of directors of the Kidney Cancer Association and a kidney cancer survivor. And we're going to talk about the fight against cancer escalates in March because it's National Kidney Month. Okay, doctor, where is the kidney in the body?
The kidney is located in the back, basically above the pelvis. So there's two, as you know, and one on each side of the spine. So unfortunately, because it's in a location that if it causes pain, it's back pain, which is very common, it's very hard to pick up.
It's very, very hard to what? I'm sorry?
To diagnose kidney cancer because
Really?
the symptoms are often either very nonspecific or absent. And one of my biggest frustrations as a kidney cancer specialist is that I am unable to diagnose most kidney cancers early enough. They present to me usually when the kidney cancer is spread beyond the kidney.
So how do you even try with it? Is this MRI kinds of things?
Well, you know, if you have symptoms that there are only a very few of them, and one of them, for example, is blood in the urine and back pain together or a lump in the back, the only way to pick it up is really with a CAT scan of the abdomen that includes the kidneys or sometimes an ultrasound. And that's going to show a mass on the kidney. Now, obviously, people should not get CAT scans if they don't need it. And that's the problem. There is no good screening test that you can do to pick up kidney cancer routinely in people.
Okay, now, just so if there's somebody out there with, what kind of a pain is it, or what are some of the, symptoms that somebody could maybe be worth speaking to a doctor about?
So classic symptoms of kidney cancer would be back pain in the region of the kidney with blood in the urine and an associated mass or lump in that same area. Now that's very rare, unfortunately. Most kidney cancers are completely silent, and often the symptoms that present are because of spread to the organs. So if a kidney cancer spreads to the bone, you might have pain in the bone, or if it goes to the liver, you might have liver pain. That's unfortunately a sign of late-stage disease, though.
Okay. If you find it in the early stage, and Sarah, we're going to talk to you in a moment or two. If you are able to find it, what kind of procedure do you do to try to eradicate it?
Correct. So if you find kidney cancer early, that means it's located in the kidney only and has not spread. The way that is treated is with surgery. So the kidney cancer needs to be removed. Sometimes the entire kidney needs to be removed, sometimes part of the kidney, but that is a first step in every kidney cancer diagnosis when it's picked up early.
Okay. Sarah Wise Miller, you're with this Kidney Cancer Association, and I'm looking at a website here, kidneycancer.org. Tell us about the organization. Tell us some of the good things you have on the website. And when was the organization started?
Well, actually, the organization was started 20 years ago by a kidney cancer patient. And I just want to add that I myself was diagnosed with kidney cancer 10 years ago. So this is a cause that's very dear to my heart. The Kidney Cancer Association spends a lot of our effort on educating people and providing resources for patients and their families who are diagnosed with kidney cancer, as well as we support the medical community with medical symposia every year, one in the United States and one in Europe. There are 200,000 people living today with kidney cancer, and every year 58,000 people are diagnosed with kidney cancer. So it's important that we are able to get the word out, spread knowledge, increase awareness about kidney cancer, and that there is quite a bit of hope. While it is difficult to diagnose it at an early stage, more and more people are discovering they have kidney cancer at an early stage as a result of other tests being done for other reasons, and that's my story basically. So I want to emphasize how important it is for each of us to be aware of what's going on in our own bodies, because I did not have any classic symptoms of kidney cancer, but I did have something that was nagging at me, that was bothering me, and I did follow it up with my physician, and luckily she ordered the correct test to discover that I did have kidney cancer. That was 10 years ago. At that time, there was only one FDA-approved treatment for kidney cancer. Oh. We're very lucky that in the last 5 years, 6 additional therapeutics have been developed for the treatment of advanced kidney cancer.
And what was that you were feeling at that moment? Or you said it was something else that led you to a doctor?
Yeah, I had some abdominal pain that turned out to be something innocuous. I had it for a number of days, wasn't going away, and I followed up on it. Totally unrelated to my kidney cancer, but I am very lucky that I went to a physician who was concerned enough to do follow-up tests that did show the kidney cancer.
Doctor, over the years, obviously you've been involved with this for some time. Any idea how people get it?
Well, you know, kidney cancer, of course, like most cancers, is mostly a mystery as to how people get it. Now, there is a very rare genetic type of kidney cancer, which is really not something that people should worry about. There are some risk factors, though, that you should be aware of that you can help maybe lower your risk. One of them is smoking. Smoking might be a bit of a surprise, but it does cause kidney cancer as well. Having high blood pressure that's not well controlled, being obese, so we advise people to lose weight. And the other thing to be careful about is if you have someone in the family that has had kidney cancer, especially a family member that might have had it at a young age, then your risk is higher for kidney cancer.
I was just looking in the subway this morning about how good the recovery is if you do stop smoking, right, for your body.
Absolutely, and stopping smoking is one of the best things that anyone can do for a number of reasons. You know, not only cancers, like cancers of the lung, the head and neck, kidney, bladder, but also just emphysema and, you know, chronic heart disease and things like that, which are aggravated by smoking.
Sarah, last question, because I know you guys got to run. How can people get involved with your organization, the association?
Well, please go to our website. You have given that information. It's kidneycancer.org, and you can get tons of information. You can find out how to get involved. We have a number of ways that people can get involved in the fight against kidney cancer.
Okay, I see there's an international symposia. So it's a worldwide, doctor, it's a worldwide concern?
Yes, it is. In fact, on a global scale, kidney cancer is even more common than in America. So it is a global concern. And the fortunate thing is, as mentioned earlier, there's 6 new drugs approved for kidney cancer, which are being now used all around the world. And research is going on everywhere, including the United States.
All right, good news. Thank you both very much for sharing this positive news. And hope it gets out to a lot of people, and we can get closer to healing this concern. Thank you very much.
Thank you.
Thank you.
Bye-bye.